question is to the Premier. Premier, the open letter from the Tasmanian GPs expresses their dismay at the disconnect between the actions that have been taken in Tasmania so far to prevent the spread of the virus and the global evidence, what that shows needs to be done. On current growth rates, the now 400 cases today in Australia of COVID-19 would become 10,000 by the 4th of April. That's just in a few weeks' time. New South Wales has admitted that they have exponential growth in their state, and that is apparent from the data in Victoria as well. So we've got precious time to act and to isolate people in Tasmania who've come from mainland states as well as travelled from overseas, and Tasmanians who've returned to the state, and to close schools to reduce the spread of the silent infection which exists in Tasmania. I listened to your answers to earlier questions about why you wouldn't have 14-day self-isolation for everyone entering the state by sea or air. And with respect, I think the reasons you gave for not doing that were trivial and could easily be resolved by prescribed exemptions for trade and by requiring people like the Chief Health Officer to have a teleconference instead of flying interstate. These are pretty obvious responses. So the longer you delay, the longer schools will have to remain closed, and fundamentally these measures are inevitable. You've already said that they're inevitable at some point. You're delaying. Every day we delay increases the risk to Tasmanians. So will you use these measures, those two measures that have been strongly asked for by the medical community, to protect Tasmanians today?
Thank you. The Honourable the Premier.
Madam Speaker, I thank Ms Woodruff, Member for Franklin, for that question and her interest in this matter. Look, as I have said, we are acting on advice. We are taking advice from the country's health professionals. In terms of the Australian Health Principal Protection Committee, which is meeting today and has been meeting on a daily basis, the best advice that I have to hand at the moment is that schools should still continue, obviously with appropriate social distancing measures. But as I've said, should that change, we are well prepared to move to a distance learning environment to support our students. But I would make the point that once the schools close, they will be closed for a very long time.
Did you hear my point? I do agree
Madam Speaker,
that is the case.
Madam Speaker, I've been clear about that we are acting on advice in terms of that measure. In terms of other border controls, again, I've been clear in this place this morning that I am taking advice on that. There are challenges that would need to be managed and understood, and there are challenges that need to be understood and taken
Order, please.
And taken into account. Can I just say, Madam Speaker, none of these matters are trivial. None of these matters are trivial.
Relative to the cost of not acting, they are.
Madam Speaker,
Order, please.
We will take advice from experts. As I've said, our number one priority is the health, wellbeing and safety of Tasmanians. And importantly, Madam Speaker, we want to ensure that they can have a job, Madam Speaker, under these circumstances as well.
I want to know they'll be
But Madam Speaker,
and the people they love,
we have, as of Sunday night, the country has put in place stricter international border controls, which we have supported. We've also taken a further step whereby anybody who has travelled from overseas, whether they be a visitor to this country, this state, or a Tasmanian returning home, that when they arrive at an entry point, at one of our entry ports, then they must fill out a Tasmanian access card. They will be provided with information in terms of how best to manage and to understand the onset of the disease should it occur to them. Importantly, where to call and who to contact to receive assistance. And my understanding is that each and every one of those people will receive a text on a daily basis reminding them of the need for self-quarantine, but also inquiring about their health and what other services they may need to support them.
They're grossly under-resourced.
Now, Madam Speaker, again, and I will make the point, it was the first question, it was the first question, I think, from the Leader of the Opposition when I provided this response. I'm taking advice on this. If that advice is to implement stronger border controls, then in a heartbeat I will do that. In a heartbeat I will do that. But I'm relying on the experts to provide that advice.
Look at the world, Premier.
We will be having.
Is doing.
There is another meeting of the national.
Works.
There is another meeting of the
required.
National Cabinet tonight.
It is
And we
required.
will again discuss these matters. If the advice changes, I will act in a heartbeat.